Thank you to Karen and Linda, both RNs who work together at NYU Winthrop Hospital in Mineola. Thank you to Lauren, an emergency room registered nurse at Mount Sinai South Nassau Hospital in Oceanside. Thank you to James from Lindenhurst, who works for Coletta Air, flying essential goods around the globe. Thank you to Bill, a local 28 journeyman from Deer Park. Thank you to Sebastiano, a UPS driver from Lindenhurst. Are you an essential worker or know someone who is? Then we want to hear from you. All we need is the picture, the person's name, the village or town, and what that person does for a living. Every night, right here at 7, we will be thanking the people who have been on the front lines during this pandemic. Just go to the News 12 Facebook or Twitter page. Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Long Island Jewish Medical Center to help you sort through what's going on with COVID-19 in our communities and obviously across the regions. And we always want to hear from you. This is a call-in show, so call in, please. 516-393-1800. Well, the news we have been waiting to hear. Yeah, after more than 2 months of being shut down because of the pandemic, Governor Cuomo says Long Island is on track now to begin a gradual progress of reopening. That'll be next week. And today, President Trump deemed houses of worship essential. He demands that states reopen those immediately. He even went so far as to say if governors don't comply, he will override them, though there's no federal law that allows that. Now to the latest numbers. Today is day 83 since the outbreak began. Statewide, there are more than 358,000. So look at those numbers there. Every number is a person. It's just astounding. Long Islanders, we account for more than 78,000 of those people. Nassau Executive Curran says only 4% of people being tested now are coming up positive. That's positive news. Governor Cuomo says deaths from the virus also continue to decline, both in Nassau and Suffolk. And Suffolk Executive Balone says the county is making progress, hitting those benchmarks for reopening. Nassau Executive Curran says Nassau has seen a huge decline from where we were at the peak. Statewide, the death toll has exceeded 23,000. The pandemic has claimed the lives of almost 39 Long Islanders. All right, let's get to the discussion right now. Joining us tonight, Dr. Nancy Kwon, the Vice Chair of Emergency Medicine at Long Island Jewish Medical Center and Associate Professor at the Zucker School of Medicine at Hofstra. Thank you so much for your time. Thank you for everything that you do every day. How are you and your colleagues holding up?
I think we're doing well. The COVID cases have decreased. The hospital is not as busy right now, and I think people are just getting a little bit of a break right now. So we're doing okay right now. Thank you for asking.
Oh yeah, no, and you and I were talking before the show about the fact that because things are improving, people shouldn't. I mean, it's important for people who might be sick with other things that they're not afraid of coming to the hospital, right?
Yes, I think one of our concerns is our emergency department volumes are decreased, but we know that people are still ill and still have emergencies, and that they should seek attention at the emergency department if they do have an illness. The emergency departments are safe. We've learned a lot about COVID, and it is safe to come to the emergency department. We disinfect, we separate people into different areas, whether they have COVID or not. So it is absolutely safe to come to the emergency department to seek medical attention. We don't want people to get more ill because they're not seeking the attention that they need.
Yeah, it's important for people because you don't want to stay homesick and then make it even worse for yourself. Let's get to some of the questions. Ricardo, are you there?
Yes, I'm here.
What's your question tonight?
I'm wondering if you could contact COVID from like ordering a meal in a restaurant.
So, that's a great question. There isn't good evidence about getting it from food. I think some of the recent data shows that it's really human-to-human airborne transmission, and thus the importance of social distancing. And I know people in restaurants these days are being very cautious in terms of cleaning and handling the food very carefully.
Okay. How about Jean? Jean, are you there? Janine, are you there?
Yes, I'm here.
What's your question?
Hi. I have a question about the antibodies. My daughter, she's 23. She tested positive for the antibodies, and and we think she had it probably in the beginning of March. I was tested, and I tested negative, and my son did as well. I'm just wondering, can you be exposed and maybe either have natural immunity to it, or does everyone who's exposed get an antibody to it?
So I think that's a really great question. There is antibody testing that has really expanded across New York State as well as the country, and it's not really clear 100% what it means. So, I think it is a little bit reassuring that if somebody has antibodies, chances are they were exposed. It may provide some immunity, but it is not clear how long that lasts and how strong that immunity is. And it is possible for one person to have obtained the antibodies and another person not to. So we don't clearly have all those answers, and there's more research that's being done in that area. That's a really great question.
Yeah. I need to clear something up real quick. Apparently, earlier I said there were 39 people who passed away from COVID-19 here on Long Island, 3,900. That's certainly a huge difference there. I forgot the 100 part. Let's go to Ann. Ann, are you there?
Oh, yes, I'm here.
What's your question tonight?
Okay, I'd like to know, my husband and I both had coronavirus, and we're over it. We're better. Tomorrow is our 50th anniversary, and my family wants to come over, which is 2 daughters, 2 son-in-laws, and 3 grandchildren. If we social distance, can we stay together in like a big room with masks on? I mean, can we eat together? We don't know what the proper protocol is, and there is a 4-year-old involved and an 11 and a 12.
Yeah, and I think, first of all, I'm very happy to hear that you had coronavirus and that you're doing well, and congratulations on your 50th wedding anniversary. That's a big milestone. In those celebrations, I know people want to gather together. New Jersey, for example, they did allow for people to gather in groups of 25 and smaller. I think you have to maintain the social distancing. It's very important, and 6 feet apart I think would be important. I think outdoor spaces are probably, being outdoors is a safer environment. We do know that the closer you are in contact to somebody, there is higher risk, and masks definitely can reduce the airborne and the contact and the transmission of COVID virus. So I would take caution in gathering together. It's a hard decision. I know people really do want to gather together, but the social distancing is so important.
So, Doctor, let me follow up on that. Is it more dangerous the length of time that you are exposed to someone who might be positive, or is it just the fact that you are exposed? I mean, if you're walking down the boardwalk and you pass somebody, is that more diminished of an effect than if you're sitting in a room with someone for a length of time?
I think being on the boardwalk or being outdoors, there was this dispersion of the virus. So there's been some evidence that being in the outdoors, there's less likelihood of transmission. So I think being in a room, being in close contact, especially if it's less than 6 feet, there probably is a greater risk.
Okay, so how do you and your colleagues handle this on a daily basis? I know you guys you're really exposed to the virus. I know you're wearing PPE, but at times when you're in your office and other times, how do you deal that in the work environment?
Well, we're very cautious in the work environment too. Luckily, where we work, the PPE, there's plenty of it, and we use all precautions even when we're in the office. We don't gather even when we're in the office, so we maintain our social distances. Even within the emergency department setting, we don't have any large gatherings or meetings. Everything is done through the computer or through phone meetings. So we've really been careful about maintaining that distance.
Yeah, that is the new normal right now. Zoom and Skype, that really is the new normal. Let's go to Carol. Carol, you there?
Karen.
Oh, is this Karen or Carol?
I'm Karen. I don't know if you're waiting on a Carol.
Okay, it can be Karen. We can take it that order. Karen, what's your question?
Okay. Hi. I've been working through the pandemic at an animal shelter. My white blood count is routinely low, like 2.8, and has been for years. I'm on hydroxychloroquine for Sjogren's and Raynaud's, but it hasn't affected the count, and I'm healthy otherwise. Does the low white blood count make me more susceptible to the virus? 2.8, and has been for years. I'm on hydroxychloroquine for Sjogren's and Raynaud's.
Doctor, is the low white count an issue?
So I think that's a great question. Having underlying disease could put you at risk. The low white count, it sounds like that's sort of been your baseline for many years, and certainly having a low white count or a high white count can mean that you're immunocompromised. So it is a possibility. I think that's a great question for your doctor regarding your particular medical problem. But I think it sounds like the good news is you maintain that blood count and have been generally well with that white count. So it is a possibility, but I think it depends on everything else that you have going on.
Okay. How about John, if we can get John in? John, are you there?
Yes, I am.
What's your question tonight?
Okay, doctor, with all the ambiguity about the different testing, we have the regular COVID test and we have the antibody test. Is it prudent to get both tests? Wouldn't it be better to get the COVID test if you're positive or negative and then get the antibody test? Because what I'm understanding, even if you get the antibody test and have antibodies, they don't know. I think it'll just be a little bit more in depth, especially for the antibodies, to know if you've had the disease or not.
So I think the COVID test itself, we generally get that to determine if somebody is acutely ill with the disease. That the antibody test suggests that somebody has been previously exposed or may have some immunity. We still don't have all the answers as to what having antibodies means, how long it may confer protection for. So those are great questions. We don't have all the answers, and I think researchers are spending a lot of time studying this and trying to get some answers very quickly to us.
Yeah, it's hard to believe that it's only been about 4.5 months since we first even started hearing about this. We're going to take a real quick break, and when we come back, we're going to have much more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you, so call us with your questions. That number is right there at the bottom of your screen. We'll be right back.
Special Report is brought to you by Montefiore Einstein. Our governor has asked us all to join the fight against COVID-19. Sticking together and staying home flattens the curve to save lives.
Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Nancy Kwon, the Vice Chair of Emergency Medicine at Long Island Jewish Medical Center and Associate Professor at the Zucker School of Medicine. Thank you again for your time and everything that you're doing. Let's go back to the phones with in Medford. Ingrid, are you there?
Yes, I'm here.
What's your question tonight?
Hi, I just have a question. I'm concerned with people buying takeout food from all the restaurants and bakeries and things like that. So, like, say, for example, you go buy an apple pie or some kind of pastry from a farm or a bakery, and the people are either not wearing the proper PPE the correct way, or they cough on it, or they handle it. Is it contagious? Will it give you the virus, or by cooking it will kill the virus?
So that's a great question. I think I sort of similar to a previous question that was asked about the food, and one of the things that I mentioned is that, from recent evidence, it seems like the transmission is really mostly airborne and person-to-person transmission. So, there is some evidence that it could stay on surfaces sometimes for days, but there hasn't been really good evidence that it's been transmitted, or any evidence through food. I think these days most places are very cautious. Everybody is wearing masks and very careful in handling and cooking food. So it is a great question, but I think, the way that the restaurants are handling foods and the bakeries, I think it's pretty safe.
Okay. Let me ask you this. As we start to open up our economies and people are going outside and gathering more, are we good now? Do you think this is the time we should start do that from a medical standpoint?
No, I think we absolutely still need to maintain our social distancing. That's what helps to flatten the curve and improve and reduce the COVID cases. We don't have a cure. We don't have a vaccine, even though researchers are working very rapidly. And there are some possible promising therapies, but there are no definitive answers yet. So until we have that, we do have to maintain our social distancing and sheltering at home.
Okay. How about Gwen from Uniondale? Are you there, Gwen?
Yes.
What's your question tonight?
I want to know, ask doctor, I have COPD, and but when I go out, I wear a mask. Is there anything else I should be doing?
Yeah, so COPD certainly is one of the diseases that puts you at risk with COVID, and wearing the mask is key. The social distancing is key. Hand hygiene, washing your hands often. I think all that is very important to maintain your safety.
Yeah. How about Casey? Casey, you there from East Islip?
Yes, how you doing? Good evening, everyone. I am a local union 638 steam fitter construction working at the Jacob Javits Center in Manhattan. I was recently told not to work there back in March. I just recently came back to work this past Monday. How safe am I?
So thank you for at the Jacob Javits Center and for being a steam pipe fitter. So if your question is being there working, I think if you maintain all the things that we say, wear a mask, wash your hands frequently, social distancing, then most likely you are safe. So I think those are the things that we know has flattened the curve and has protected people.
Okay. How about Constance from Uniondale? You there, Constance?
Yes, I'm here. Thank you. Mm-hmm. My question is, I had the coronavirus, and then I was tested for the antibodies, and the antibody level came back to be 5.8. And I wanted to know where is that on the range? Is that bad, good, or low, high?
So there's different companies that are making antibody tests. The 5.8, I imagine, means that you're positive. And most tests, when they report, they may give you a level, a range, a ratio. So that's what you received. But they'll also tell you that you were positive. What that range means is not clear. I think most people feel that the higher the ratio is, that's the higher the antibody level, and that's possibly or probably a good thing, but we don't know all the answers to that.
Okay, and real quick, if you could answer this, I'm just going to summarize it. Paul from Centereach wants to know how long this can last in the air. I know there's a study where it can last up to 8 minutes in the air, but that was under controlled environments. Do we have any other evidence of that?
Yeah, so I think those are answers that we need more of. The researchers are studying sort of the pathway of the virus, how long it lasts, and there are many people who are researching it. So certainly it can last in the air for many minutes. We know it can last on hard surfaces even for days. And you know how communicable it is, and the transmission in these scenarios is what we have to learn more of.
Okay. Unfortunately, that's all the time we have. Have a great holiday weekend and stay safe all holiday weekend. And you stay safe. Have a great time. Thanks for watching, and we'll be back on Tuesday at 7. Have a great holiday.